Hello, everyone. My name is Francesca. Can everyone hear me? Jonathan will be joining us in just a few minutes. He's having some connection issues. So we're going to start the presentation, the webinar, and he's going to join us very soon. I see people from all over the US, all over Canada, Janet from Australia, Patsy, North Carolina, Sharon, you're visiting from Toronto. I'm actually from Hamilton, Ontario, near Toronto. Pamela, hello from Las Vegas. Lucy, Penticton, BC. Oh, hi, Jono.
Hey,
Hello.
how's it going?
Good to see you.
How's it going?
Fantastic. Perfect.
Awesome. Thanks, Fran, for jumping on. And guys, I'm coming to you live from between Boston and Rhode Island. About to land in Rhode Island. I was just at the Harvard Club of Boston to do an interview, and then I'm headed to take the next 2 hours with you guys, or about an hour or so. We'll see. And I'm excited to go through this with you guys. We've got a lot to share, and so let's dive in. And friend, it's fine for you. I'll call you back in at a certain point, and
Okay.
and then thank you so much for your helping, and I appreciate you guys all for being on. So
Okay.
Josie, hello. David from Edmonton, Canada. Um, Diane from Jupiter, Florida. Gail from upstate New York. Jolene, hey. Myra from South Carolina. Bob from Vancouver, Canada. Awesome. And then Sandy, Lucy from Penticton, Penticton, British Columbia, Canada. Well, you would know Francesca being from Canada. Pamela from Las Vegas. Janet, Josie, awesome. And Kimberly, awesome. And so we're going to go through and get into some of this presentation here. I want you guys to come on a deep dive with me. Welcome to this presentation. All right, so here we go. So check this out, guys. So welcome to our PEMF webinar. This is Cellular Healing Made Simple. So let's have a look at what we got for you. Let us know where you're joining from around the world. I want to hear, I want to know where you're from, and interact there, guys. It's really lovely to connect. And so if you're feeling overwhelmed by a cancer diagnosis, or struggling with a relentless flare-up of some kind of autoimmune condition, a mysterious, bizarre, unexplained illness, you're exhausted by treatments and uncertainty, and your symptoms are not giving up. They're not letting you go. You're like held hostage to a condition. You're not alone. There's so many folks that are in the same journey, the same struggle. That was my struggle. That's my wife's struggle, and countless others. Literally billions of people around the world are suffering at some level because of widespread toxicity, because of a lack of balance that we're getting. And one of those things is departure from getting the Earth's natural magnetic field. We're not getting it because of the concrete jungles we're living in, and the homes that we're living in, the beds that we're sleeping in. And we're missing out on a critical part of health and healing. So millions of people face the daily struggles of cancer, autoimmune conditions, and other chronic illness. But here's the hopeful truth. Your body is designed to heal and it has extraordinary abilities to repair and restore itself when given the right care. You don't have to live with constant fatigue, chronic inflammation, or the heavy burden of symptoms and side effects. By addressing the root cause with a holistic approach, you can strengthen your immune system and calm your symptoms and take real steps towards lasting wellness. Begin your journey back to health, freedom, and vitality, and reclaim the vibrant life you were created to live. And so here's my disclaimer. I, Jonathan Otto, do not claim that any information shared with you will treat or cure any disease or symptoms. This webinar is based purely on my personal findings on PEMF, some red light therapy also, sauna and light therapies, as well as published studies, papers, and articles on pulsed electromagnetic field therapy. Devices advertised in this webinar are not the same as the devices used in the following mentioned studies. Those are in almost all cases not disclosed. But what they do is they use parameters. Those parameters are parameters whereby you can either reverse engineer and complete and perform and expect the same result, or even exceed and better the technology, combine the therapies in this case. For example, combining red light and PEMF. That's brilliant when you think about the fact that most studies are with those two technologies, but in isolation, or far infrared heat. And what would that do in combination? Well, you could potentially expect a compounding effect. And so we show what the studies are saying and also give feedback on what some of the most powerful ways to do these therapies and even arguably get better results than what you can see in the following studies. So their content is included without implying any endorsement of the products that are under discussion. So today I'm excited to share some groundbreaking insights that can transform your health and healing journey. Get ready to explore some powerful natural healing strategies perfect for those facing fatigue, pain, or long-term illness recovery. I'll introduce PEMF and its role in accelerating healing. You'll learn how to reduce inflammation and restore energy naturally. Discover how activating the body's innate healing potential, how to do it. This webinar will help you reclaim your health starting today. And so here's my research and experience. I've trained with world-leading medical doctors, so both ways. So I've been trained by and also trained leading medical doctors. In fact, a lot of our resources, a big part of the films that I've created and the work that I've pioneered is consumed and used by medical professionals, and it becomes a staple for many of the most cutting-edge physicians. They've been using our resources just like you have, and they're using them in clinical settings. And this is including actually working with world-leading holistic therapy centers. I've been training in these facilities, training doctors and in certain therapies and helping them so that they can get the best results for their patients. And it includes cancer centers. These are cutting-edge therapies that help the patients get the best outcomes. So the 2 degrees that I graduated with was a bachelor's degree in communications with a double major in journalism and media production from the University of University of Newcastle, and then the postgraduate degree in education at the University of New England. So growing up, I struggled with many painful chronic conditions, and nobody knew what the real root cause was or how to fix it. And that's what set me on my journey. And these included Ross River fever, glandular fever, Epstein-Barr virus, cytomegalovirus, Lyme disease, chronic fatigue syndrome, heavy metal toxicity, parasitic infection, brain fog, chronic boils, chronic nausea, chronic dehydration. And that wasn't everything, but it certainly was a lot. And some of the ones that really wiped me out was the chronic fatigue. So a lot of these things all come together, and then what you're left with is being tired all the time. And in my case, I had to quit full-time work in my early 20s. And so just think about what my life would look like now, being a few months short of 40. What would my life look like? I think I said, what would my wife look like? Yes, well, that's true too. I'll show you what my wife would look like. So please stay until the end of our live question and answer session, because you'll get the opportunity to ask your questions, and you can listen as I deep dive further into those powerful health benefits as I answer your specific questions and the answers of others that are also looking for health and healing. So PEMF has the potential to heal. And so you look at chronic pain relief and cellular inflammation reduction and supporting cancer and autoimmune recovery. So a randomized placebo-controlled trial on PEMF for chronic pain with 40-minute sessions twice daily for 7 days. Patients showed significant pain improvement. And then you've got PEMF therapy for cellular level inflammation reduction. PEMF therapy reduces inflammation by suppressing pathways like NF-κB and MAPK, lowering cytokines and supporting tissue repair with clinical studies showing pain relief. And then it's also supporting cancer and autoimmune recovery, with PEMF being applied to breast cancer cells, and this was shown to reduce their growth, viability, and trigger cell death and senescence. So that's what's fascinating there. And so I'm going to show you this video from Dr. Tony Jimenez, and he's going to give you some really key insights into how this works.
With respect to PEMF, or pulsating electromagnetic frequencies, I like to say also that in 2014, 10 years ago, I integrated PEMF as a staple foundational treatment in integrative oncology. And now we see that many centers in the world are using PEMF. Remember that disease starts at the electrical voltage part of the cell. We have the cell that forms tissues, the tissues form the organs form the system, the respiratory system, digestive system, and then the systems form our body. But disease starts at that cell level. And that's where the voltage potential is so important. Cancer cells have a low voltage potential, -30, -40 millivolts. Healthy cells are -90, -70 millivolts. As a normal cells become diseased or damaged, that voltage potential decreases. So when we administer PEMF, we are upregulating voltage potential to healthy cells, and guess what? Cancer cells cannot tolerate that higher voltage potential.
Awesome. So fantastic. So let's continue on that. And so Francesca, then now if you can go again and read from and continue on this section here, and come back here. And guys, Francesca does a lot of research with me, and I love her perspective. I love, she's actually conducted probably getting into the hundreds of interviews now, and she does such a fantastic job. And so, introducing to some of the people behind the scenes, somebody that's super connected and kind of really understands a lot of these key aspects. And so she's going to take you through just a couple of these slides as we continue, and I'm going to be then taking back over, and we may also play another video here in a moment. I'm looking forward to this next section here. You're muted there, Francesca. You're muted.
Oh, my apologies.
Okay.
Thank you,
No
Jonathan. We'll talk about more benefits of PEMF therapy, bone density rebuilding, and fracture healing. A randomized controlled trial found that PEMF therapy significantly improved healing in delayed long bone fractures with union rates of 77.4%. And also, PEMF neutralizes harmful EMF exposure. It lowers inflammation by improving blood flow and oxygenation at the tissue level. This helps ease swelling and discomfort linked to chronic conditions. As well, it enhances sleep quality and relaxation. 69.7% of PEMF participants no longer had clinically significant insomnia by the end of treatment. Major improvements seen in ISI scores, sleep latency, and efficiency. And I don't know about other people, but I struggle with my sleep. And I mean, it is so significant to every part of our health. So this is really fantastic solution.
Yes, I have. Thank you, brother.
And
yeah, you can as well. Thank you, brother. Yeah, thank you, my friend.
PEMF for chronic pain. It works at a cellular and neurological level. It reduces inflammation, improves circulation, and modulates pain signals.
Thank you.
Which leads to greater comfort and improved quality of life.
Thank you.
And there's a lot of research supporting its safety and benefits. So PEMF therapy is becoming a valuable addition to chronic pain management strategies alongside conventional treatments. And in fact, there's a 2024 review in the Journal of Clinical Medicine that found PEMF therapy reduced pain by 60% in people with osteoporosis. Pardon me, osteoarthritis. And PEMF therapy has shown consistent, non-invasive, drug-free benefits by supporting underlying healing processes, which include enhancing microcirculation to promote oxygen and nutrient delivery, stimulating cellular repair and regeneration, especially mitochondria activity, which is so significant, improving lymphatic drainage to remove waste products and reduce swelling, accelerating tissue repair and muscles, ligaments, and joints, balancing electromagnetic signaling across cell membranes to restore cellular function, and as well decreasing oxidative stress by promoting antioxidant action. And there's a study on PEMF for anxiety. A recent clinical trial involving 485 participants found that pulsed electromagnetic field PEMF therapy applied to the neck can positively influence the vagus nerve, which helps regulate stress, relaxation, and overall balance in the body. By gently stimulating this nerve, the vagus nerve, PEMF was shown to significantly improve sleep quality and reduce anxiety levels, with a 16 hertz frequency producing the most noticeable benefits. And so what makes this especially exciting is that the improvements not only occurred during the treatment, but lasted a week after stopping. And these findings suggest that PEMF therapy offers a safe, non-invasive, and most importantly, drug-free way to support better sleep and relieve anxiety, making it a very promising tool for overall well-being. And we have studies on these, and if people want to learn more about these studies, just contact our customer service and we're happy to send those out to you. And a study investigating the effects of and this is the information on that study that we just read. And it showed the results demonstrated significant improvement in sleep quality, anxiety, resulting especially noticeable at the 16 hertz. And as I said, please contact us if you want a copy of these studies. And a review on PEMF for chronic pain. A 2025 study found that PEMF therapy can safely help reduce chronic lower back pain and improve movement. By using gentle PEMF, it appears to calm pain signals, improve circulation, and support the body's natural healing process. In trials with over 400 patients, about half of those patients, about 200 patients, showed meaningful pain relief, especially when the PEMF was combined with physical therapy, and there were no serious side effects reported. And again, that's very promising for a non-invasive and drug-free therapy. And this is the study that we're referring to. Concluded that PEMF is safe and beneficial treatment for lower back pain, particularly if it's used in addition to physical therapy. And the PEMF protocol for chronic pain. A session duration initially begin with 10 to 20 minutes per session, once or twice a day. Maintenance phase, after 2 to 4 weeks, reduced to once daily or every other day, 15 to 30 minutes per session. And the application areas, position the applicator directly over the painful area, for example, the lower back, knees, neck. For widespread pain conditions like fibromyalgia, use a full body mat is the best option. And a treatment schedule, acute flare-ups 2 to 3 times per day until the symptoms subside. And for chronic pain management, 5 to 7 days per week, initially tapering into 3 to 4 times per week after symptom improvement. And you're the best judge of how much your body needs. Start slow, work your way up, and see how your body is doing. Progress monitor, assess pain levels weekly using a pain scale. Adjust the session length, frequency, or intensity based on tolerance and results. And some additional tips, avoid placing the applicator over open wounds or implanted in electrical devices like pacemakers. And consistency does matter. Stick to the schedule for optimal results. Don't skip hydration. It supports cellular detox and better energy flow. And combine PEMF with light stretching for additional benefits. And for muscle loss, sarcopenia is an age-related muscle loss that leads to weakness, slower movement, and higher risk of falls and fractures. It reduces independence and quality of life, and many older adults find it hard to manage with exercise alone. A 2025 study showed that PEMF therapy can help older adults with sarcopenia, a condition that is marked with muscle loss and weakness. After just 12 sessions, participants had stronger leg muscles, moved faster and more steadily in walking tests, and reported fewer depressive symptoms. Muscle size didn't change much in such a short time, but the improvements in strength, mobility, and mood suggest that PEMF may be a safe and, again, drug-free option for elderly people who struggle with traditional exercise. And this is the study that we're referring to. And in conclusions, in summary, the short-term study suggests that PEMF therapy may promote meaningful improvements in low limb muscle strength and functional mobility in older adults with sarcopenia. And PEMF for cellular inflammation. It benefits chronic pain relief. PEMF restores the electrical balance in cell membranes, allowing better nutrient absorption and waste removal, which is key for reducing inflammation. And in fact, nutrient malabsorption is a major cause of disease, so this is so important. It enhances circulation and oxygen delivery. By boosting microcirculation, PEMF increases oxygen and nutrient flow to the tissues, helping clear out inflammatory byproducts more efficiently. It reduces pro-inflammatory cytokines. PEMF lowers levels of inflammatory molecules like TNFA and ILIB, helping calm chronic inflammatory processes. And it supports mitochondrial health. It supports mitochondria improving energy production, the ATP, and helping cells recover from stress and inflammation faster.
And that's fantastic, Fran. I think that yeah, keep going. I'll have Fran continue here for just a couple more minutes. And you're doing an incredible job, and I love some of this information that you've been sharing, because the mechanisms are fascinating. For those that have attended and watched some of the presentations we've been doing on red light therapy, it's interesting that we were talking about mitochondrial health, and now through magnetic field therapy, we're talking about interfacing with mitochondria, but it's not with light this time, it's through magnetics. And it's fascinating. So if you see this type of thing with a PEMF mat, when it's plugged in, you'll see the magnet bouncing around in a plastic cage. Just you watch this real time to see that it's interfacing, and that your body's clearly extremely electrical. And I notice this every night when I'm in bed and my hands run across the sheets. What do you see when you do this, Fran? When your hand runs across the sheets at night?
Well, sometimes you get those electrical shocks.
Exactly.
Is that what you're referring to, Jonathan?
Yeah, exactly. And then you could visibly see them, right, as well.
Yes.
And you can feel it. You can feel these little zaps, and you can visibly see it. But don't overlook that. People, you have to think about this, guys. Imagine if you did that one night and you had the exact same setup and there was nothing. You saw nothing, but you normally did. Would that help you understand that your electrical voltage is extremely low, and that could be a massive risk, and maybe the biggest risk for cancer and autoimmune disease and every type of thing that you don't want? And that's what Dr. Tony Jimenez was talking about. The cancer patients he's seeing, they have low voltage, and they're suboptimal. And so what's he doing? He's increasing their voltage. He's increasing their cellular potential so that the cells can do what they need to do. And he's interfacing with electrical charge. So this is a key aspect, and one that I'm really excited to share and have people understand. And so then we're interfacing with the mitochondria, but not through light. It's through the magnetic field. And by doing this, we're replicating the Earth's Schumann resonance and the Earth's natural rhythm, pulsating this magnetic charge through the body, having the body then perform cellular function. All right, keep taking it away, Francesca.
Okay, so PEMF for inflammation and healing. To summarize the review, it explored how PEMF therapy modulates inflammation in soft tissue, cartilage, joints, angiogenesis, and wound healing. And its mechanisms of action are PEMFs suppress key inflammatory pathways, the NF-κB and the MAPK. So it reduces pro-inflammatory cytokines and influence extracellular matrix remodeling, largely through the activation of adenosine A2A receptors. And the preclinical findings, in vitro and animal studies highlight PEMF's ability to control inflammation, enhance angiogenesis, and speed up tissue repair in cartilage, wounds, and soft tissues. And some clinical insights. Though evidence is still emerging, small human trials report that short-term symptom relief and functional improvements in early osteoarthritis, post-arthroscopy recovery, and cell repair. Therapeutic potential. PEMF is presented as a promising, non-invasive, and drug-free adjunct to traditional therapies capable of supporting healing by reducing inflammation and stimulating tissue regeneration. And this conclusion supports the idea that PEMF helps with cellular inflammation because it is not simply masking symptoms, it's actively altering gene expression and protein signaling within inflammatory cells, which leads to reduced oxidative stress and faster healing. So preclinical and small clinical studies strongly support PEMF as a safe, non-invasive therapy, and again, drug-free, for reducing inflammation and enhancing tissue repair at the cellular level. Thus, the review provides both mechanistic and early clinical backing for the use of PEMF in treating inflammatory conditions. And this is the study that we were referring to. And it said preclinical and preliminary clinical results suggest that PEMFs have a spectrum of biological actions, including the suppression of inflammation and enhancement of soft tissue repair. And PEMF for cellular inflammation. A 2025 study shows that PEMF works like a gentle cellular reset, helping the body calm inflammation and heal more effectively. So by sending pulsed magnetic signals into the tissues, it boosts cellular energy, improves blood flow, and helps nutrients and oxygen move in while flushing waste out. This reduces the chemical messengers that drive pain and swelling, while increasing signals that promote repair. PEMF also supports nerve and tissue regeneration by activating repair cells and growth factors. So in simple terms, PEMF helps quiet the body's overactive inflammation alarm, recharges cells like a battery, and creates the right environment for faster, more complete healing. And this is the study that we were referring to, and I'll just read it. Low frequency, low energy PEMF specifically achieved anti-inflammatory effects by increasing adenosine A2A and adenosine and A3A receptor expression in various cells and tissues, which leads to reduced pain and inflammation. PEMF stimulates osteoblast activity, promoting osteogenesis and bone matrix synthesis through diverse pathways, including selective interaction of calcium-related pathways to favor osteogenic differentiation, oh my goodness, of bone marrow stem cells. The synergistic effect of PEMF and PMB2 further enhances osteogenic differentiation of human bone marrow mesenchymal stem cells by modulating BMP signaling components. So in the context of neuroinflammation, PEMF shows therapeutic potential mainly by modulating the JNK MAPK signaling pathway in microglial cells. So if anyone would like a copy of this study, please contact our customer service. We'll be happy to send that to you. and you can do more research on it yourself. It's really amazing. And PEMF protocol for cellular inflammation. So initially you want to begin with 20 to 30 minutes per session, once or twice a day. And then you will go into a maintenance phase after about 2 to 3 weeks, reduced to 3 to 5 sessions per week, depending on your symptom improvement. And you want to place the PEMF coils or mats over the main affected areas, such as joints, abdomen, or full body, if systemic inflammation is present. And for generalized inflammation, a full body PEMF mat may be used for even exposure. And consistency is key. Most people notice changes after 2 to 4 weeks, but for deeper systemic inflammation, 6 to 8 weeks of regular sessions may be needed. And some more tips. Hydration helps cellular detox post-PEMF sessions. Combine PEMF with anti-inflammatory lifestyle habits like sleep, nutrition, and stress management for your best results. And PEMF for cardiac function. PEMF therapy has been shown to help the heart recover after a heart attack. In a 2025 study on mice, PEMF improved heart function and reduced the size of scars left on the heart muscle. It works by calming inflammation, helping heart cells survive, and preventing too much scar tissue, known as fibrosis, from forming. Scientists found that PEMF turns down overactive pathways that normally drive damage and stiffening of the heart. Importantly, it was safe, causing no harm to the liver, kidneys, or gut bacteria. And again, it's one of its greatest benefits is that it's drug-free. This makes PEMF a promising non-invasive option for protecting and healing the heart in people with heart disease.